Chapter 15, Pregnancy, Childbirth, and the Purpurium Code Series 000 through 095A. And this section is pretty much pregnancy complications. All right, so this is a list of the categories, and if you just kind of skim through them, you'll see pregnancy with abortive outcomes, supervision of high-risk pregnancies, edema, proteinuria, and hypertensive disorders in childbirth, other maternal disorders predominantly related to pregnancy, maternal care related to the fetus and amniotic cavity and possible delivery problems, complications of labor and delivery. Now, right here, this encounter for delivery, these are not complications. These are probably one of the few O codes that are not complications, but your encounter codes for delivery, 080 through 082. Complications predominantly related to the purpurium and other obstetric conditions not classified elsewhere. And there are key terms that you should be familiar with. You should know that antepartum is the period of conception to birth. So that's before the infant was delivered. Peripartum is the last month of pregnancy to 5 months postpartum. Postpartum is right after delivery through 6 weeks. And purpurium, this is clinical term for postpartum. Now, let's get to the guidelines. Let's know the rules. What are they? All right, we're going to start with guidelines C15B1. When you are coding for a routine prenatal visit and there are no complications, remember chapter 15, these are pregnancy complications. So if there are no complications, you use an encounter code, and that's Z34 category. You're going to code that first, followed by the week's gestation. All right, guidelines C15A1, pregnancy incidental to the encounter. Now, what is that? Well, that means that the pregnancy is not the reason for the encounter. It's incidental. In fact, we have a patient here that sprained her ankle. She goes to the ED, but she happens to be pregnant. Incidentally, she's pregnant. So she goes there and she gets treated for her sprained ankle. The doctors don't even treat her pregnancy. There's no need. So what they do, they're going to have to code first the reason for the encounter, which is the sprained ankle, followed by pregnancy incidental, Z33.1. All right, so don't report codes from chapter 15 for the RFE, for the reason for the encounter, because we have to code what is being treated, but we have to acknowledge that the patient is pregnant. All right, coders, are you with me? I know I'm moving a little fast, so don't want to do that. You all with me? Type your, go ahead and let me know in the chat. Okay, someone said, yeah, I'm with you, Mrs. J. All right, anybody else, or am I moving too fast? I'm going to slow it down when I need to slow it down, because I just think mentioning these items are good, just to kind of mention it, just to kind of put it in your head. And then when you go back and revisit, it's going to make sense, much, much more sense. All right, trimesters, pregnancy trimesters. When you're coding from chapter 15, often you'll be required to indicate the trimesters, specifically if the codes don't mention the trimester or the week's gestation. All right, so you might have to code the week's gestation or trimesters. And just so you know, the first trimester is less than 14 weeks. Second trimester is 14 weeks to 28 weeks. And the third trimester is 28 weeks until delivery. And someone asked last week, hey, how do I know the trimesters? Well, they are listed in your ICD-10-CM. It's somewhere in chapter 15, but around, I'm not going to tell any stories, but it is in chapter 15 in the tabular list. But you can just write this down if you choose. Now it's time to move on to guideline C15B2. Prenatal outpatient visits for high-risk patients. There are multiple reasons a patient can be high risk, but this is one that people often miss, all right? So typically, a woman with chronic conditions is a high-risk patient, and pregnant women aged 35 and up, they're high risk too. In fact, they are labeled as elderly. But it's not meant to disparage anyone, but that is what they're termed. And pregnant girls 16 and younger, they're labeled early. So this is an example on the right of how it is documented in ICD-10-CM 009.5, supervision of elderly, primigravida, and multigravida. So this is a patient that's 35 years of age and older at expected date of delivery. So if she's 34 and she's got a birthday coming and she's expected to deliver after her birthday and she's going to be 35, then she is considered elderly. And this is her first, um, hmm, hmm, okay. Okay, I'm sorry, I got a little sidetracked. I'm sitting here reading like, Okay, so if she's in the first trimester or third trimester, you would sequence accordingly. Also, if you go and you look at the young primigravida and multigravida, that patient is less than 16. So you know what? We have this wrong. You know, Mrs. J got to fix it. All right, so here we go. She's 15 and younger. All right. All right. So, yes, she's 15 and younger. So, all right. So make sure you write it here. I would write it in here. And yeah, I'm a little stumped because I've always said it was 16 and younger, but it's 15 and younger. All right. So young, primigravida, and multigravida. So it doesn't matter which pregnancy it is. Primigravida means first pregnancy, multiple. They've had multiple. And remember, and means and or. All right. You all with me? So I would write 15 and younger right there. Stumped me. All right. So the category for high risk pregnancies, 009. You sequence that first if it is a high risk pregnancy. Now, guidelines C15C, hypertension that existed prior to pregnancy. You know, it means that the pregnancy did not cause this. And you're going to code O10, pre-existing hypertension, complicating pregnancy. And your second code will be your hypertension code, depending upon what type of hypertension she has. Guidelines C15F, HIV in pregnancy. Those guidelines are very specific, and you'll have to sequence first your HIV complicating pregnancy code, you have to sequence from chapter 15 first, followed by whether it's Z21 or B20. So if there are no symptoms, Z21. If the patient has symptoms, B20. And if they have any HIV related conditions, you're going to sequence third, that HIV related condition. All right, moving right along to guidelines C15G and C15I. Diabetes mellitus in pregnancy. We reviewed this in endocrine section, but let's go ahead and let's review again. So if it's pre-existing diabetes, that means the diabetes existed prior to pregnancy. The diabetes existed first. So what does that mean? That means that the code is 024.1, one for first. Gestational diabetes, if the pregnancy was if the diabetes was caused by the pregnancy, we're going to call it gestational diabetes, right? And that code will be 024.4. Hopefully that helps. It does. All right, so now you know what I do think we need to talk about before I move on? We talked about hypertension in pregnancy, right? There is a type of hypertension in pregnancy called preeclampsia, right? Yeah, I think I'm going to add this. I want to just um, make you aware that that is a form of hypertension, and I will include it next time. All righty, and that is caused by the pregnancy, the preeclampsia. All right. So I'm going to call Miss Stephanie to the floor, and I'm going to ask her to read these scenarios. But before she gets started, I want to review how to solve an ICD-10-CM scenario. All right, so first things first, we're going to inventory or highlight or your keywords, diagnoses, signs, and symptoms. We are going to choose or think about the first listed or the principal diagnosis. That will help you, definitely. That's like 50% of the task. And then finally, apply all guidelines. All right, Miss Stephanie, please and thank you.
Thank you, Miss J. Hello, coders. A O 03.6, B O 03.1, C O 04.6, and D O 02.1. A patient had a spontaneous complete abortion 3 days ago. She returns to the ED and is bleeding. After the ED provider examines her, she still has retained products of conception, POC. What ICD-10-CM code is reported for this encounter? Coders, you have 2.5 minutes and your time begins now.
Okay. Good job. Good job. I think a lot of people are just being forensic, and that is outstanding. So let me go ahead. I want to see my chat. Good, good, good. All right. Here are my keywords. Previous spontaneous abortion. The reason why I put previous is because it was 3 days ago, right? She returns to the ED and is bleeding, and she has retained products of conception. All right. So I put here that this is signs and symptoms. Is it? I don't think that's a sign and symptom. Oh, maybe it is. It's a sign and symptom of the abortion, maybe. But why is she here? She's here because she's bleeding, and I don't think it's I don't, she's here and she's bleeding, right? And this is a sign and symptom of the abortion. However, the retained products of conception is why she's here, right? That's why she's here. All right, so I'm going to pull the guideline because I need some guidance. You all hear me? And this guideline C15Q2 says termination of pregnancy and spontaneous abortions, retained products of conception following an abortion. And coders, if you don't know what product of conception is, product of conception is any tissue related to a pregnancy. Any tissue. It could be blood, it could be parts of the fetus, any tissue related to a pregnancy. That's products of conception. All right, so when you have, oh, let's go here, termination of pregnancy and spontaneous abortions without complications, you're going to sequence first either O03.4 or O07.4. O03 category is spontaneous abortions, and O07.4 is incomplete spontaneous without complications. So the first one is with. Oh, they both said without complications. So let's go ahead and look at the code. All right, so let's go ahead and look at the language within the second column, because this is taken directly from ICD-10-CM guidelines. There is the portion in the middle is identical to the guidelines. We just pretty much copy and paste it over. Now, whenever you see this highlighted portion, this is not, this is our language. So let's see what they're saying. They said subsequent encounters for retained products of conception following a spontaneous abortion or elective termination of pregnancy without complications are assigned O03.4. Incomplete spontaneous abortions without complication is O07.4. So the difference is this is spontaneous abortion or elective termination of pregnancy without complications, and this is incomplete spontaneous abortion. So that keyword is incomplete. All right, let's continue. So we're going to look up our codes, and these are our diagnoses here and or signs and symptoms. So O03 is spontaneous abortion category. We're nowhere in the right section. And if we go down to O03.1, this is the code for delayed or excessive hemorrhage following incomplete spontaneous abortion. Coders, in our documentation, there is no mention of incomplete spontaneous abortion. And when you see green language, that language is key, and it should be in your documentation, or there should be some synonym. That's an important keyword that ICD-10-CM has acknowledged. So incomplete, there's no mention of an incomplete abortion. In fact, we have a complete abortion. So if you said B, forensics was key, but that's okay. We had an aha moment, so we're going to get rid of B. Next, 003.6, this is delayed or excessive hemorrhage, and we had bleeding, following complete or unspecified spontaneous abortion. And I do like this code. I do, because it's a complete spontaneous abortion and there still was hemorrhaging. So I like it. I'm not going to eliminate it until I see the others, okay? All right, so we're going to go to 004.6. This is delayed or excessive hemorrhage. Okay, that's good. Following an induced termination of pregnancy. Well, there's no mention of induced termination of pregnancy. So we're going to get rid of you. And we're also going to get rid of 002.1. This is missed abortion. There's no mention of a missed abortion. And so we're going to get rid of 002.1 as well. Got to go. And the best of the four is A, delayed or excessive hemorrhage, complete or unspecified spontaneous abortion. Someone asked a good question and said, hey, if a patient retains products of conception, would it be complete or incomplete? We can only code what that documentation says. And if we don't know, we'll need to query the doctor because we can't tell if it's complete or incomplete. An exam can only do that, right? Yeah, so we have a complete abortion and she still has retained products of conception in this case. Great, great question. All right, so moral of the story, always code to the documentation. Code what you read, what the doctor documents, and not what we think. And that is a fabulous question because it would seem like that would be a complete abortion, incomplete abortion. All right, Ms. Stephanie, please and thank you.
Thank you. A, Z34.83, Z38.38, B, 09.613, Z38.38, C, O09.513, Z3A.38, D, O09.523, Z3A.3A. A 45-year-old female, gravida 3, para 3, at 38 weeks gestation presents to her obstetrician for her 38-week prenatal visit. History of present illness. The patient reports that she has been feeling well and has no complications with her pregnancy thus far. She denies any nausea, vomiting, vaginal bleeding, or abdominal pain. Physical examination, the patient is well developed, well nourished female and no acute distress. Her vital signs are as follows: temperature 98.6 degrees Fahrenheit, heart rate 80 beats per minute, blood pressure 120/90, mmHg, respiratory rate 16 breaths per minute, and oxygen saturation 98% on room air. The prognosis for this patient is good. She is at low risk for complication with her pregnancy and is expected to have a healthy baby. Caller, 2.5 minutes again. Time begins now. I wish you well.
Okay, coders, you all are rocking it. Absolutely. I see phenomenal, great answers in the chat. But when you learn how to code for pregnancies, there are only certain things that you need to look for. You don't, even though this scenario is a little longer, but there's just some key things that we need to code for. This patient is 45 years old. She's gravida 3, para 3, 38 weeks gestational. This gestation, she's there for her 38-week prenatal visit. And so far, she's had no complications with her pregnancy. So I'm going to inventory. I'm going to inventory her age. That sticks out. We just talked about anybody over, no, at 35 years of age and older, that's high risk. So I'm putting it there. And even when you're inventorying, you can write high risk next to it. I would encourage you to do it because this is an exam that you just might forget. Why did I write that? 45 years old, high risk. You know what? I'm going to write it. That's important. Yeah. So that means that we need to be extracting codes from the high risk section, right? Yeah. So that's what I'm going to do. 45-year-old, high risk, 3 pregnancies and 3 live born, 38 weeks gestation. These are all of my key terms. Now I'm going to the guideline. When you have prenatal outpatient visits for high-risk patients, you need to sequence that supervision of high-risk pregnancy code first. 009 followed by any applicable Chapter 15 codes or weeks gestation if applicable. So we're going to get rid of A because A is not sequencing that high risk from the high risk category. Got to go. Now we're going to go look up the remaining codes. All right, so let's go ahead and do our due diligence. Why is Z34.83 incorrect? If we go to the Z34.8 category, this is the category for encounter for supervision of other normal pregnancy. What the heck is that? You know what? Maybe the doctor has to specify it, but we have a specific category and we have a guideline that tells us when someone is 35 and older, they are high risk and should be coded from the 009 category. So let's go ahead and look down Z34.83, encounter for supervision of other normal pregnancy, 3rd trimester. So it's not really talking about the patient being 45 years of age and older or high risk. So we're going to get rid of A. Gotta go. Now look at B, C, and D. The subcategories at B is a 6, so 009.6, but C and D share the same subcategory code or character 5, and I want to take a look and see what are the differences. So if we go to category subcategory 6, 009.6, yes, the category is 009, and that means high risk, but point 0.6, that means that this patient is less than 16 years of age. So any code within this subcategory range is going to be incorrect and not applicable to our scenario. So we're going to get rid of the 009.613. You got to go because she is not young and this is not her first pregnancy. All right, 009.5, supervision of elderly, premigravida, and multigravida. We're in the right subcategory. Now, what's the difference between C and D? Well, the difference is 1 and 2. So 009.151, this is for first pregnancy, elderly, premigravida. That means first pregnancy. And 009.52, supervision of elderly multi-gravida. This is appropriate because our patient had 3 babies. So gravida is the number of pregnancies, and para means beside. That is the number of liveborns. So our patient had multi, and we're going to code for it. And the correct code is 009.23, supervision of elderly multi-gravida 3rd trimester. Outstanding. A lot of you said D, and a lot of you had an aha moment. And in the chat, they're shouting you out. I'm seeing champion coder. I'm seeing rock star. I'm seeing people showing out. Indeed, indeed, indeed. And the moral of the story and the takeaway is watch when you're coding pregnancies. If they are 35 and older, we need to, oh, we did fix that. That's an old guideline. If they're 35 and older, go ahead and code them as high risk. All right, so if you have questions, go ahead and type it in the chat, and we're going to move on. I'm going to ask Miss Stephanie to come to the fore.
Thanks for tuning in, and until next time, happy coding!